So individuals with diabetes may take various medications to manage their blood glucose levels and address any associated complications that is associated with their diabetes. Now, the choice of medication particularly depends on the type of diabetes. We've talked about type 1 and type 2 and the specific needs of that individual and any associated complications. So I'm just going to talk about some common medications that are used in the management of diabetes. So as well as the glycemic control, patients are usually prescribed a statin, and blood pressure control is optimised, so they might be on an antihypertensive as well. So for type 1 diabetics, insulin is prescribed, and people with type 1 diabetes will always require insulin because their bodies don't produce this hormone, and that's part of the underlying issue. So the insulin is typically administered through injections or an insulin pump. You might see patients with little pumps attached to their waists. Type 2 diabetics, now some individuals with type 2 diabetics may also be on insulin, especially as that disease progresses and is not controlled. Now, insulin can be short-acting or long-acting, or they can have a combination of both, so it's very individual to the patient. The oral anti-diabetic medications are used particularly for type 2 diabetes, and you might have heard of metformin. This is a commonly prescribed medication, and metformin improves insulin sensitivity and reduces glucose production by the liver. Some of the other oral hypoglycemics, such as sulfonylureas, such as glipizide, these stimulate the pancreas to release more insulin. There are others on the market, such as meglitinide, and these also stimulate insulin release, but they have a shorter duration of action than the sulfonylureas. Now, there are other drugs on the market such as DPP-4 inhibitors, such as sitagliptin or saxagliptin, and these work by enhancing insulin secretion and reduce the glucose production. There are others as well called the SGLT2s, sodium glucose cotransporter 2 inhibitors, and these are like canagliflozin, and these increase glucose excretion in the urine. So pioglitazone improves insulin sensitivity. And then there are GLP-1 receptor agonists, and these medications mimic the effects of naturally occurring hormones called glucagon-like peptide 1. And these drugs, they stimulate the insulin release, but they suppress the glucagon secretion and slow down gastric emptying. So a variety of different medications there, and some patients will be on combination medications of these. And the combination medications, which include sometimes 2 or more types of anti-diabetic agents to address multiple aspects of the glucose regulation for that particular patient. Now, I mentioned that they might be on an antihypertensive medication because optimizing blood pressure control is really important. And we know that patients with diabetes are at an increased risk of cardiovascular complications. So it's important that you might see patients that are on an anti-diabetic medication plus an antihypertensive plus a statin. So some of the ones that they might be on are ACE inhibitors, angiotensin II receptor blockers, the ARBs, beta blockers or diuretics. And then I also mentioned statins because it's important they have a statin to manage the cholesterol levels and again reduce the risk of cardiovascular events. So the statins may also be prescribed in addition to that. So the overall management of diabetics is not necessarily one set for all. It very much depends on the patient, the type of diabetes they have, their overall health as well, any other medical conditions that the patient has. Also, patient preferences are sometimes considered as well. Their lifestyle modification in addition to medications, which includes diet and exercise, is also taken into account, and they will often have a lifestyle plan that's really important for them to follow. Now, patients' control is important for you to be aware of. Any changes to their medications you should be made aware of, and the patient should let you know, and you should review this every time you see them with regards to their medical history. So I hope that gives you a bit of an insight into the many types of medications used to treat diabetes.